owner was very happy. Of course, the problem is the normal fertility. So there was a very interesting study that was done in Czech Republic, in Brno, by our colleague Dr. Robert. I saw him recently, still going on these studies of recuperation of fertility, anticipation of recuperation of fertility. And what he did was very simple. He had 8 cats. He implanted them with a 4.7 implant. And 4 months later, he removed the implant. So at the beginning, he implanted the cats in the interscapular region. It was not so easy to remove, so now he's implanting them in the post-umbilical area. And in these 8 cats in which he removed the implants, he followed their testosterone level and their sperm quality by electroejaculation. And what he found is that in the 4 months following the retrieval of the implant, all cats recovered a good testosterone level and a normal semen quality. They were not put to reproduction, so we cannot say that the fertility was good, but if the semen quality was good, we can think that probably the fertility was reversed. So maybe that's a possibility that you may have in cats to implant them in the post-umbilical region, for example, or under the skin of the rear leg, and after 3 or 4 months, remove the implant so that you don't have such a long inhibition of reproductive function. But of course, for a normal owner, having a cat that they just don't want to castrate, exactly like dog owners because they don't want mutilation or something, you can do the same as in dogs, implant the cats and reimplant them all their life. And in such a case, you don't mind about the length of inhibition of reproduction, just castrate them, and that's all. Any questions on cats? Yes?
We know that cats can be highly sensitive to different substances. But do we have any reports of, for example, injection site sarcoma or any other adverse reaction after the injection? Thank you.
You're welcome. So this is something we have spoken quite a lot in congresses because we are in cats a little bit scared to implant them in the interscapular region for the risk, of course, of getting sarcomas. So far there are no reports, but I think it could be an option to implant them on the rear leg. Really, it's still unclear that, as you said, is it the injection by itself which create the risk, or also the substances that you put? So, so far there is no report of the risk. But no report doesn't mean no risk. It means just no report. So I personally, I don't implant cats in the interscapular region. Yes?
I would like to ask, as I understood, this owner wanted to show the cat while the implant was in the cat. What about the rules of the show rules? And also, for example, I assume you couldn't show a dog with the suprarenal implant because of the testicular size diminishes. Is it different with the cats, or would it be considered doping? Actually, I think with the dogs, with the FCI rules, it would be considered doping and not allowed in the shows.
So it's different, but one of this problem is also one of the problems stated by cat owners, cat breeders, that they cannot, sometimes they have problems in getting in shows. So this is also a problem, because the testes sometimes become very small. For dogs, it very much depends on the judge you are going to see, because the rules of FCI is that you need to have 2 testes in the scrotum. The testes don't disappear, you still feel them, but they are small. So for some judges, it's accepted. I know some dogs under superiority with small testes that go in shows and there is no problem. So I think probably you are right. If you follow very strictly the rules of FCI, You are right, but in reality it's not so certain.
Then it would be something you have to advise the owner about.
It's like, for example, if you have a testicular tumor or if you have an injury of the testis and you have to remove the testis, the vets can write a paper stating that they had to remove the testis for medical reasons. So I think probably we could make a paper with spread. But because it's a castration and because castrated dogs are not supposed to go on shows,
And also the behavioral.
so this is a good problem that you raised, but once again I don't have the answer. I don't know, Miria, do you have any idea on dogs or cats going in shows during plantation?
Yes. In Finland, it's forbidden for dogs that are having the implant to go to shows. It's restricting heavily the use of this implant in Finland. I don't know the other rules.
In theory, it is the same, but after I don't know what the people are doing in reality. So I know some dogs that were implanted with quite small testes and they were on shows. They just said, oh yes, my dog since he was young had small testes, and the judge didn't say anything. Okay, so I think it's time for the break now. Thank you very much.